Hello, this is the conversations about grief and gambling. And I am Leilani Iser Reed with the Mid-Hudson Problem Gambling Resource Center. And we have Dr. Larry Force here with us again. And we're just having these conversations just to it's an impromptu, very impromptu conversation. We do pick topics, but we don't really talk about what we're going to talk about because that's the whole point of having conversations, right, Dr. Force?
Absolutely. And thank you so much for making these arrangements and having the idea to, put this into action. Um, as you say, I mean, it's a conversation. It's informal,
Yes.
but also informative.
Informed and informative. Oof, I'm
Right.
gonna write that one down because,
Please write that in capital letters.
and then
Okay.
I'm gonna quote you.
Well, you can say we came up with it together, but it's informal and informative,
Informative.
and that's the intent of the conversation.
That is the
We
intent. And
Well,
I
prior to getting together, Lonnie will call me and say, "What do you think about this as a topic?" We'll talk about it a little bit. Talk about it a little bit before we, actually start recording. And here we are.
Here we are. I truly believe that we don't know everything, and we can read textbooks, we can study different things, but I think we gain a lot of knowledge through conversation because your perception of something is could be different than my perceptions of something, and versus to any person out there, and that's the only way, I think, not the only way, but that is another way that we can definitely learn, and we don't have enough conversations. So let's start off with, because we are our theme is about grief and gambling. So I'm going to start off with like the notion of what is causing your grief or you grief. And I started thinking about what causes me grief, and and then grief in terms of sorrow or just pain and just something that's just really annoying, that's really nagging at me, that's really draining my energy. And what is causing me grief is, it could be what's going on in the world today, right? It could That's causing me a lot of grief. Um, but then I'll ask you that question. What's causing you grief?
Well, I think, it is world events for sure. I think that, it's real time. I mean, think about all the connection we have. You know, Years ago, I don't mean to sound like my grandmother, but years ago there was a daily paper,
Right,
6 or 7 o'clock nightly news. Now today there's a instantaneous paper. You know,
right.
I mean, we're being onslaught. The onslaught of information. Years ago, in studying psychology on the undergraduate level and then graduate level, I remember uh, taking courses on memory and psychology. And they used to say, it's important to remember, but there were some theorists that said it's just as important to forget because you can't remember everything. And if you try to remember everything, it's too much, it's an overload. And think about the information that we engage in now. We don't need to know how to engage in information. We're talking about strategies of learning how to disengage.
Mm,
And this whole idea of grief and loss, and before we started to record, we talked about your term of gambler's fallacy. Why do people do the things that they do? When I see a new client, I always say to them, at the very beginning, I'm not your hero. I can't fix you, and the reason I can't fix you is because you're not broken, because we all have stuff. I
right.
also tell them, based upon my personal belief, that the best psychologist you can find is one you forget, because you get back into the rhythm of your life. Now, I have colleagues who are research trained. I mean, the practice of psychology, some practice as researchers and statisticians, and I look at psychology as an art from the practice side. And my friends in the research side will say, in psychology, behavior can be predicted and controlled. From my perspective, yeah, maybe in a laboratory, but the reality is people do the damnedest things. The
Right.
most predictable thing that is predictable about human behavior is that it's unpredictable. So the question is, why do people do these things? In light of the fact that some of them, I write a blog on a weekly basis, and one of the blogs I wrote about was, wouldn't it be great if we could all live the lives we say we want to live at 7 a.m. in the morning? Because when we go out, or a person goes out and they engage in behavior that they don't want to do, or they say they're never going to do, at 7 a.m. in the morning, they make these deathbed commitments, they're never going to do it again. And then we catch up to them 2 o'clock in the afternoon and they're back engaged in it.
I think we do that because at a young age we are taught that we can control. We have to control our behaviors. You can't just go out there and just do anything. And because the remembering of we have the ability to control ourselves. So in the ability and in the understanding or knowing of controlling ourselves, we think we can control the outcomes of life. So
Right. And I,
and
that, that,
that's the fallacy. We can't control anything.
right.
We can control possibly um we can possibly control how we react, but then it's like, at what point are you controlling your emotions with that? Because then that will also bring a lot of grief and pain when we're trying to control so much we don't feel.
right. And I think, that whole not feeling, distraction, numbing process. I mean, on the behavioral side of the house, the group that's in the behavioral perspective of psychology, they talk about the fact that all behavior can be learned, all behavior is learned, and all behavior can be unlearned. So how you learn a behavior will dictate how you unlearn it. So if you learn it in a continuous reinforcement approach, somebody's drinking every single day they're drinking, their world's fragmenting, they're feeling horrible, versus somebody who's gambling, where gambling is not learned on a continuous reinforcement schedule. It's learned on an intermittent schedule. You win, you lose, you lose, you win, you win. There's no predictability to it. So when you start talking about extinguishing it, the person giving it up, it takes longer to do that because the patterns that they've been exposed to have been unpredictable. They win, they lose, they're going to stop, then they win again, and then and it's an adrenaline thing too. It's why do people, I'm working with a client right now, the husband's making these commitments, never going to do it again, and then she finds out he's done it. And one of the things that we talked about is, how many times has this person heard the word no? How many times has this person heard the word stop doing it, or there are going to be consequences? Mm-hmm. How many times has the person said, I'm going to stop? But they're not.
But that's just like childlike behaviors, right? The child is, and like if the child says right, no, they're gonna reach, they're gonna possibly go for it again.
Right. And I think the simplest and most powerful definition I ever heard about the addictive brain versus the non-addictive brain is that when the non-addictive brain gets the buzz, whatever it is, through substance, through gambling, through sex, through shopping, whatever it is, when they get the buzz, they stop. When the addicted brain gets the buzz, it's off to the races. Now, there is an intervention, and it's kind of like a renegade approach, and you have to be real careful in employing it, but it's called a paradoxical intervention. So for years, I worked on the back units of state institutions, and I saw a lot of self-abusive behavior, people self-mutilating, pounding their head against the wall, doing things like that. Now, safety obviously is the main concern. But in the paradoxical intervention, instead of having the person stop, saying stop, 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 you say to them, hey, I kind of like this behavior. Why don't you bring it up a notch? Why don't you amplify it? And it's almost like a shot, because they've heard for so long, you need to stop. And now what you say to them is, you know what? Obviously, you're not going to stop. You don't want to stop. So why don't you take it to the next level? But you got to be, just your facial expression is usually the facial expression you get, because the person's like, what are you talking about? Well, if you're really going to do it, then do it top shelf. Do it, amplify it. Do it as,
but can't and that be a detriment though? Like, can't that?
Of course, I mean, right. I mean, you
I mean, it's not like I haven't heard of it. It's not like I haven't heard somebody say, well, if you're gonna go hard, go hard. It's right. It's the same notion. Like, right. Go big or go home.
right, but right, exactly. But the problem is that you need to be prepared that the person might truly follow your advice and really take it to the next level. I think that if we could capture anything, this idea of grief and loss, what do we know? We know that we say things to ourselves that we would never, nobody talks to us more than we talk to ourselves. And we say things to
That is true.
ourselves that we would never allow anybody else to say to us. We are our own worst critic. My personal belief is that if you feel better about yourself, you'll feel better about the things around you. So now the person comes back from an experience where they've had losses. What's the feeling? Sorrow, grief, remorse. But Freud believed in this homeostatic model that people, they don't really necessarily love going up the adrenaline, but they love the feeling of coming back down. I mean, gambling is not just what happens when you're at a table or at a casino or at wherever, however you're gambling, but it's the anticipation of, it's that thought, I'm going to do it. It's the actual activity, and then it's the discussion with yourself on that long ride home. I'm sorry we don't have the ability to capture the discussion the person's having with themselves as they're driving away from the event. I heard a
But
great
can
statement
but
one time.
but okay, so, well, maybe not in that moment, but in therapy, possibly people have had those conversations with their therapist of like what they were feeling and in that moment. And also, I wonder if therapists are talking about what is making you think that you can win. You're especially those who could be knee deep into their gambling habit or their gambling addiction, that they're going to beat the odds. That next bet is going to be the
Oh,
one that's going to get them over the hump.
because it's that, as we talked about, preparing our discussion for today, it's that magical thinking. It's this magical thinking that the next engagement is going to be the one that's going to bring me back to where I was. It's magical. It's not reality based. But you've heard the old statement: you can't expect rational behavior from somebody who's irrational. I mean, somebody who's really engaged in the behavior and the atmosphere of the gambling, procedures and process and behaviors, the brain's on fire. One of the things that I always say, and this is to the credit of you and the organization that you work for, but people that come in through your network, through the New York Council on Problem Gambling, they come in hot.
Mm-hmm.
They come in like meteorites that are coming through space, not in control. And I see my role as a therapist and my colleagues is to be able to help them, not do it for them because we're not that powerful, but help them stabilize and come in for a nice soft landing because they come in on fire.
Right.
Either they have a spouse that has lit them up, or a court system, or a job, or maybe they're engaging in practices that they're not able to meet the needs of people that they borrowed money from. I mean, there's a lot of things that the reason the person comes in, and this whole grief and loss thing. I mean, I'm working with somebody now, and one of the things that we're working on, which is pretty successful, is this idea of a mindfulness approach.
Mm-hmm.
So I'm not talking about a yoga mat, 45-minute
You're
lotus
you're kind
position.
of talking about just being understanding where your mind and how your mind is working.
Where you are in the moment. So
Mm-hmm.
now here comes this guy. He has an addictive pattern of behavior. He's going to stop it. However, that thought arrives, okay, that he's going to engage in whatever the behavior is. I'm
Right.
not going to get descriptive about what the behavior is, but he's going to engage in that behavior. And then he turns it into an action. And with the mindfulness approach, when that thought comes, you learn how to help manage your own thoughts. Just because you have a thought, some people call it a craving,
Mm-hmm.
just because you have that doesn't mean you have to walk it all the way through into a behavior. There are ways that you can help dismantle or dilute that thought. One of the images that I use like clinical hypnotherapy in my practice. And one of the images I use for guided imagery is the person is standing on the middle of a freeway, and here come the racing cars. You don't have to get hit. You can step back. Imagine yourself stepping back and watching these cars and feeling these cars race by you. Same thing with these thoughts that come up. You don't have to get hit with the thought and move it into action. You can have the thought and then learn strategies in order to manage your own thinking and be able to move back and let that craving pass. Because all cravings pass. You don't have to manifest
it. And it's all about that's the mindfulness part of being able to step outside yourself and just see things from afar, and then being able to then make a choice as to how you're going to move forward. And I don't think that that definitely takes time and skill to not engage, but to take a step back and just it is that mindfulness. And it's a self-discipline, and it's a self-awareness that you have to be able to take that step back. And that's something definitely that learning myself, in terms of my own personal life, in terms of having that self-awareness of not to engage in possibly things that I don't need to partake in, that things are conversations or with people and energy that's not going to serve me. So on one side, I could sit there and just go whole in, but it does take a deep awareness of recognizing when it's happening and then taking that step back. And that's not something that is taught.
No, it's not. But I have a dear friend, Dr. Jerry Abitiello, and she and I have been friends for years. And a couple of months ago, she was talking to me about this article that she read about comparing a mindfulness practice to the use of antidepressants.
Mm.
And the researchers were saying that as far as an outcome, they seem to be comparable. However, a mindfulness practice requires more work.
Mm.
And it's a practice. In working with athletes that may have engaged now in sports betting and things like that, I bring them back image-wise to the first day they touched that basketball. The first day as a kid they went onto that court.
Mm.
How did they feel? As they look at themselves, how did they feel in hindsight? How did they feel? How did they act? How did they, maneuver the ball? That's not the way they're doing it now. And the reason is because it required practice. Yeah. And the same thing with mindfulness. Mindfulness is a practice. It's something that can be learned.
Yes.
And one of the biggest resources and tools that we have today is YouTube. YouTube, you want to talk about how to
do anything.
How to do anything. You want to change the tire, you want to fix the sink, you want to learn mindfulness. Here's YouTube. I've recently engaged with a company, it's a startup company, a fellow named Mark Montalban. He's out of California, and he's created this entity called Mindful Text. And he's using a text-based platform in how to train people how to use mindfulness. And one of the things that we know is because of COVID, because of the introduction of the internet, the internet has changed the world, as AI and Chat GPT will continue to do that. And there are 77, 78 digital mental health and wellness platforms out there. So, you want to see a therapist, you can see a therapist from your home now. If you want, digital mental health, there's practice things, there's a lot of things you can engage with. As I tell my students, there's two things you need to bring into a family's life today: your heart and the understanding of technology. If you can only bring one, you bring your heart. So he's using a text-based platform to train people how to use mindfulness. Now, there's over 77, 78 of these digital mental health and wellness platforms that have $1.2, $1.3 billion valuations, some of them. Mm-hmm. But what employers are finding, because a lot of employers are using this as an employee benefit, what they're finding is that people say they want to use these things, but then they stop using them. Now, it's not uncommon. Years ago, we would set up a program, people say they want to use it, then they wouldn't use it. Then you'd ask them why, and it was transportation. Well, it's not transportation anymore because the technology is available, with your hand. But now what it is that's surfaced in the literature is something called app fatigue. So
App.
people say app fatigue.
Mm.
So what happens is people say, yeah, I want to use a program. I want a psychological program. I want to use something that will help, calm me down. So it's provided, but then they stop using it because people get fatigued from accessing apps and accessing websites.
Yes,
The
that
thing
does
I
make sense.
the thing I like about what Mark has created is that he has created something that you're not accessing the information, you're receiving it. And if you want to receive more, then you can say, more or context or source. But on a daily basis, what you're getting is you're getting a text that is focusing you on the moment and being able to stay in the moment and use a mindful practice. I mean, there are some people that say mindfulness can be used even without meditation. How do I look at it? It's a tool and a resource that we can provide our clients that they can use it, because when they have that thought, historically, that thought would then race through right to manifestation.
And do you like, even for me, I'm listening and I sometimes come from like indigenous practices, and to me that all of that sounds just like grounding and connecting yourself and being in the moment and understanding like earth energy. And it's just being in the moment, connecting yourself in the present, or connecting yourself with somebody, but it's just everything is just about being present in the moment and understanding where you are at in that space.
Well,
So
and that's very true. And I 5 6 years ago, I go to this conference, 5 day conference on the use of mindfulness as a therapeutic intervention. And the guy, and I loved what this guy said. A couple of things he said I really liked. He said, when you work with clients that only focus on the past, it's all about depression. When you work with clients who are only focused on the future, it's all about anxiety. Your role as a therapist in using a mindfulness approach is to help the person stay in the moment. Now, as he's talking about that, I'm sitting in probably the first 3 rows, and I'm sitting there and I got a little smile on my face because this mindfulness stuff now is hot. But look at the fellowships. The fellowships have been talking about a mindfulness approach for years. It's called one day at a time. Okay, they're bringing it down to the day. We know that relapse is part of a recovery process. So if you're watching this and you've made a commitment to go out and try to develop a new path, a new journey, and you've had a relapse, hey, that's life.
it
Okay,
happens.
it happens. We also know that families have a tendency to get better slower.
Right.
So I know a guy that's been in 15 rehabs, and can you imagine how his family felt, when he was in the 13th rehab? Like, they heard this before, they're done. He's now sober 20 years because there was a light bulb moment. Something happened that
And
he connected with.
and that does take time. And I'm thinking about the mindfulness, and I'm thinking about all of that, in staying present and staying and grounded, in regards to like going back to gambler's fallacy of, you are not here to control. If Because the more you control, and going back to that statement you said, if you focus on the past, you're depressed. If you focus on the future, you're filled with anxiety. And then with the gambler, that fallacy is that you think you can control everything, and it's not necessarily true. If you stay in the moment and just acknowledge yourself in the space that you're in, you see what's happening to you right now. You know how you feel. Even going back to what I originally stated is, what is causing you this grief? That is that in the moment, being mindful of what is happening to you in this moment. When you're
Right. And
gambling and you're dealing with, I'm going to win. I know I can win this next bet, or I know then the next time I participate is when it's my time. I'm gonna win all this money back. It's the reality with the present and where you are. What are your emotions? What are you feeling at this time?
even though we hadn't talked about this, but what's come out of this conversation is maybe the next time we get together, the focus is really on the use of mindfulness as a therapeutic intervention, as a way, as a tool.
I will write that.
Okay, I mean, what are we hoping? We're hoping that we're able to help people develop tools and resources that they can use.
Yeah, because that is another thing that is asked people always ask, what is what, and not in terms of individuals who are already in treatment, but people who want to learn more about gambling, right? They just, what is something that's going to help somebody, and you're saying mindfulness is a great tool. It's a great resource. It's a great resource for any person going through anything, and just needs to learn how to be present, how to be in the moment.
And can I add this one thing to what
Yeah.
you're saying? How to be present, as you say, in the moment, as you say, one breath at a time. Look, I have students do what I call a genogram. So they do a 3-generation genogram about their family. In our profession, we come in, we ask people, tell me about your family. And then we sit back and we take notes. It's not easy talking about family. Okay. And we all got families and they all got stuff. And I want the students to get an experience of what that feels like as they're examining their own family. And then they write up a paper with 5 indicators they pick. And what I tell them, if you write up that paper and send it to me with 5 things that are wrong with your family, I'm not grading it, I'm sending it back, because all families have strengths too.
Yeah.
So regardless of where you are in the process, either as a family member witnessing, an out of control partner, the individual themselves, or a therapist, and to the credit of you and your group, the New York Council on Problem Gambling, you've highlighted the importance of, because working with somebody with a gambling behavior, gambling pattern, there's a real specialty to that.
Mm-hmm.
I mean, because of the fact that you need a specific knowledge base of how the behavior occurs, how it presents, what it's like, from the lived experience. And I think that, as you talk about being present, in the now, one breath at a time, but that one breath at a time, if you're going to look back on your landscape, I'm going to ask you to please widen that landscape, because not everything is bad.
Mm-hmm.
There's a lot of good things going on in your life.
Right.
Yeah, maybe your partner is really outraged with you, but that also is a symbol that there's a partner that's concerned about you.
Right.
That may not feel so good, the present exchange, but there's somebody still in your life that's engaged with you, that's concerned about the welfare of you. Okay, so I think we're good for today.
I think we are great for today.
I think we're great. I think we're great for today.
I think we are. Well, I know we are, 'cause I'm grounded.
Well, again, thank you for setting this up, and off to our next conversation.
Off to the next conversation, and thank you guys for listening.